Are you thinking of having your breast augmented? Do you feel that your breast size is smaller than they should be? And if you're contemplating breast augmentation, are you in a dilemma whether to go for silicone implants or fat grafting? I am Dr. Ashish Davalbhakta. I am the Director of Aesthetics Medispa and Advanced Aesthetics in Pune, and also the lead aesthetic plastic surgeon at My Aesthetic Plus in MGM Medical College, Navi Mumbai. In this video, I am going to cover the differences between having a silicone implant or fat grafting, which is the right procedure for you and which one to go for. Silicone implant, as the name suggests, is a silicone polymer with cohesive silicone gel inside, and these are inserted underneath or behind the breast tissue or the chest muscle, and it gives you the volume and the projection. Different sizes are available. We have excellent tools to help in determining what size will suit you to give the desired cup size. And in one surgery, you can have 2, 3, 4 cup increase depending upon the implant that we put. Now, that's a foreign material. Although an inert material, it does have some risk and some complications that we will cover in another video. But in fat grafting, we suction fat from your tummy or wherever you have fat. The fat is processed and the fat is injected in and around the breast tissue. It's not into the breast completely, but subcutaneous and retromammary, in those areas we inject the fat. Now, what happens when you add fat to the breast? Of course, it adds volume. So the breast size does go up, but in fat grafting, nearly 50% of that what we inject gets absorbed. It doesn't connect to the circulation and the body clears it away. So initially you may feel like you've got a lot, but eventually by the time all the fat gets connected to circulation, you may have maybe just a cup increase. So that is one thing to note, is that with fat grafting, in the first surgery you may not get more than 1 cup increase. But yes, you can repeat the procedure after 4-6 months once everything has softened down, and you can have further fat added. You may get a little more than a cup subsequent stages as the revascularization of the breast happens. As the circulation to the breast improves with every fat grafting, the retention of fat increases. So you can have 2 or 3 cup increase, but you may need 2 or 3 surgeries to have that kind of an augmentation. As against that with silicone implant, in one operation itself, you can have 2 or 3 cup increase. The other difference between a silicone implant and fat grafting is that if you have a little bit of sagging, silicone implant can sometimes improve the projection, lift the tissues up and correct the sagging. So you can get away with just placing a silicone implant in a mildly sagged or tautic breast and not need a lift. But in a mildly sagging breast, if you add fat, it adds to the weight, it doesn't lift it up, and it can aggravate the sagging. So you have to be mindful of this, and that's why you should come to a consultant like us at Advanced Aesthetics or My Aesthetic Plus, where we can explain the reason for the procedure that we advise you. But now there's another advance that has come, which is called hybrid, and I'm going to tell you about the hybrid breast augmentation in another video. So if you've liked this video, please share it with your friends. Whoever is interested in having a breast augmentation, click the like button. If you write anything in the comments, I'll be happy to answer that. And if you like this educational material, do subscribe.